Good afternoon, my fellow Coloradans. Thank you for joining us today for an update on the pandemic, COVID-19 in Colorado. We have some special guests for you today, just to show you that it is easy and relatively painless. We have two great Coloradans over 70 that got the vaccine recently, Linda Sosa and Rebecca Vasquez. They both got their vaccine, and they're both 70 and up. Linda actually helped organize a event at St. Cajetan's Catholic Church that I went to last weekend. Rebecca got her vaccine at Servicios de la Raza. I had also stopped by that site at a different weekend as well. They're both joining us virtually, and we want to share about the personal experience of getting the shot. But the main point is, it is so easy and painless. I got it myself. My arm was a little sore the next day, and nothing else to report. Some people, just like the flu shot, some people, feel a little under the weather the next day. That's simply your immune response building your immunity. It is not the virus itself. There is no live virus. There is no way you can get the virus from the vaccine. What it does is it simply gets your immune system to respond and create the antibodies, and sometimes that causes a little bit of response the next day. But as I said, I got it, and my arm was a little sore like it always is from a shot, no other effect. You're going to hear from Linda and Rebecca, two folks that got the vaccine. The main point is, if you're over 70, please get it. I was down in Pueblo the other day, and I was at a restaurant, and I said hi to a couple that were just over 70. She was scheduled to get it. The husband looked great for 70, by the way. You'd think he was 60, but he said, maybe I'll get it. I want to save it for those people that are, that want it more, or maybe I'll just get it later. I said, look, you're over 70. That alone is a risk factor. You look really healthy. You look wonderful. He still works as a grocery store worker part-time. But please, sign up and get it if you're over 70. Our goal as a state is 70% of people over age 70 by the end of February. But we would love if that is closer to 80 or 90%. That would really make a difference in saving lives. We know it's not going to be 100%. There's always going to be a few folks out there that, for whatever reason, don't want it. But if it's 80 or 90%, that literally can translate into dozens of lives saved for our state versus 70%. So our goal is 70% and up, but hopefully if you're over 70 and watching this after you hear from Linda and Rebecca and you see how easy it was, you'll agree to get it as well during the month of February. Everybody who is 70 and up will be able to get it in February. Those 65 and up will take into that first week in March till we can get through that entire group. But there are some folks 65 and up beginning to receive it today or earlier this week. 934 new cases in our state. I'm really excited to report that hospitalizations went down again, 464. So this is the lowest we've been at since early October. In perspective, still having close to 500 people hospitalized with COVID, but 464, and we're hopeful that continues to move in the right direction, which is down, and it will, as long as we as Coloradans continue to wear our masks, avoid social gatherings, and keep your distance whenever possible. As the vaccine kicks in, protecting more and more folks that we can get through this and hopefully avoid a third peak. I was on the call with the White House this morning with their weekly coronavirus update, and two main takeaways from that. One is they are increasing our vaccine supply in Colorado by 9,000 a week starting next week. We're very excited about that. So that's at least for 3 weeks. So that means 27,000 additional vaccines over the next 3 weeks. We're excited that they can squeeze every last dose out to get to us. We get it in arms within a few days. They also announced a federal program where they, remember the previous one, they said directly with 25 Colorado pharmacies. They are now going to be sending vaccines directly to a few Colorado community health clinics. Now, for Colorado, that doesn't mean as much because we've been using community health clinics since day one as one of our distribution partners. They're great. I went to one at Salud. In fact, that's where I got the shot myself, at a community health clinic. Got vaccinated there. But we've worked with Clinica, Salud, Denver Health, so many other community health clinics across the state. But we welcome any additional supply of vaccines. And if the federal government now will begin sending some directly to community health clinics, that is wonderful. We still plan on holding them accountable for using the vaccine, just like we do all our providers within a few days of when they get it, to make sure that it doesn't sit on shelves. As of this morning, Colorado administered 559,938 first doses, 225,187 second doses. I'm proud to report that we are 71% of our way towards our goal of vaccinating 70% of everybody age 70 and up. So we are on track to meet that. And as I said, I really hope that there is enough demand where that can be in the 80 to 90% range for those who have the highest hospitalization rate and fatality rate from COVID-19, those over 70. But we are almost 3/4 of the way towards our goal. I'm incredibly proud of the progress that we're making. We continue to be in the top tier of states when it comes to quickly and efficiently administering the vaccine. There are some states ahead of us. I won't rest until we're number one. We continue that every day. There are 50 governors in 50 states, all of who want to be number one. We all can't be, but we're going to do better than the Rockies, better than the Broncos. We are going to remain in that top tier and continue to push. There are more states behind us than are ahead of us, and we're going to continue to do everything we can to get the vaccine into arms. Yesterday was the first day that Coloradans 65 and older, 65 to 69, were able to receive the vaccine. Most of the doses are still going to 70 and up, but in many areas of the state, they are starting to work in folks that are 65 to 69. If you are in that 65 to 69 group and haven't registered yet, please, you can go to covid19.colorado.gov, click on providers, sign up on one of your choice. Finishing up everybody 65 to 69 will likely take into that first week in March, meaning, of course, some will get it this week, next week, the week after, but it'll likely take into the first week in March. If you are 70 and up, we expect that group, everybody who wants it, will be completed during February. People wonder how we know these things, how I say these things. It's simply based on the numbers of vaccine that we're getting. So we do a great, strong analytical work. There's 530,000 people age 70 and up in our state, 288,000 people age 65 to 69. We now know the number of vaccines we're going to get for the next 3 weeks. Thankfully, that increased by 27,000, which is 9,000 per week. That was the announcement made today. We factor that in. That's how we determine when we expect that different cohorts will be done, and that we will be able to open up additional folks to be able to safely receive the vaccine. And look, it may take a few weeks to get to everybody. We know it will, but if you're eligible and you want the vaccine, you will get one. If you're 70 and up, you will get it in February. We already are at 71% of our goal. You can go to www.covidvaccine.org or call 877-CO-VAX-CO. Leave that phone number if you're having internet trouble, because we did get the wait times down and we're hiring more call takers. But if you're able to use the internet, please do. covidvaccine.org. But that phone number is there for you. Don't feel guilty about using it if you're having trouble on the internet. 1-877-CO-VAX-CO. If you're an educator, you work with your employer, with your school district. They are not competing against 65 to 69 or 70 and up. You don't sign up anywhere other than if your school district or a private school employer or child care center, they give you a link. That's where you sign up. Don't spend any time looking around the internet for getting a shot. That's not how it works. You are doing it through your district. And that's over a 3-week period. That just started. And our educators will get vaccinated in the next 3 weeks. I've got to personally attend a number of vaccine clinics across the state. I've been thrilled to visit partner organizations like Salud Family Health Center, SCL Health, UC Health, National Jewish, and many others. There's vaccine clinics all over the state, and it's just so exciting to see. Last week, I attended SCL Health's clinic at the National Western Complex, National Jewish Health's clinic at St. Cajetan Catholic Church, where one of our speakers, Linda, got the vaccine. SCL Health vaccinated 5,000 people over the weekend at the stock show. National Jewish, 1,000. It shows our capacity. UC Health at Coors Field did 10,000. If we had the vaccine, those sites could operate several days a week, right? They're able to operate, sometimes one day a week now, 5,000 or 10,000 vaccines. Because again, if you did the math, if a 10,000 site vaccine center operated 7 days a week, that would be almost our entire vaccine supply for the state. And obviously we can't have that all at one center because there's people in Grand Junction, Pueblo, and Colorado Springs. We do it equitably across the entire state. And I can tell you firsthand, there's just nothing that can replace the joy on people's face when they get the vaccine. And I want to thank the countless volunteers that have stepped up to help coordinate and support these centers, not just those with medical backgrounds administering the vaccines, but people helping seniors register, people helping with traffic, people helping with parking. There's so much that goes into these, and it has just been wonderful to see so many volunteers stepping up. At the SEL Center at National Western Complex, over 600 volunteers in 2 shifts really did an amazing job helping that to work well and efficiently. To share more about the personal experience of receiving the vaccine, because I know there's folks out there, I may get it, I may want to wait. it's easier than you think. It's less painful than you think. It's not a big deal. And we wanted, rather than me just saying that, and first of all, now I have some credibility to say it because I got it myself and it didn't hurt, but I know you want to hear from peers. And so that's why I'm happy to turn it over to Linda Sosas, who was one of the organizers and volunteers at the National Jewish Health event at St. Cajetan, but also got it herself there as a Coloradan over 70, and will share with you her personal experience doing that. Linda.
Hi, thank you. Thank you for inviting me. That was a very nice experience, and the answer for the people was great. And I feel safe now. When I get the vaccination, I don't feel anything. Even I was so busy, they put it on and they said you have to wait for 15 minutes. And somebody called me and I get up and I don't feel anything, any reaction, no pain, no nothing. I'm so happy that have the opportunity to get it. And very happy there's so many people that enjoyed and they come and get it, but it's a lot of work that we have to figure it out and have patience to the people. It's not the I'm going to get the flu shot, like they say. This is different. One is we saving lives. We need to take care of ourselves, that we can take care of our families, and send a message to our friends outside to take care of themselves because we can get in trouble. So many people I see suffer from that. The people, some die, some is still in the hospital. So this is a process. You need to make the announcement. You have to believe that you want to have the trust to the people that come and get the vaccination. Another thing is a process. First, need to send the message. Next is to receive the phone calls. The second one is to organize the time and where is the place to be safe and protect all the community, and come in and have the volunteers and receive them to give the trust to them. And we're done for that and wait for the 15 minutes and go home. Thank you, God. We don't have any problems in St. Cajetan. Everything went so beautiful. Thank you for being there, Governor. And one more thing is, after that, we had to have the second doses. And we had to do the same process like when we started. Now they need to come. We cannot do another clinic if we're not done with the first one. That way we have organized and everybody is in the same page. So I ask everyone to be patient, everyone to gonna get it. I'm pretty sure that we're gonna have enough for everyone. To be safe, use your mask.
Yep. Gracias, Linda. ¿Quieres decir algo corto en español también?
Seguro. Estoy muy feliz de haber recibido la vacuna. Gracias por la oportunidad. Gracias, señor gobernador, por haber estado con nuestra comunidad, y les mando un mensaje a todas las personas que hablan español. No tengan miedo, vengan y sigan el proceso de lo que es la vacunación. Pongan su brazo y participen, porque ustedes están salvando vidas, están protegiendo sus familias y esto va a pasar. Pero tengan confianza en los lugares donde están vacunando y vengan. No es nada peligroso, no duele, bueno, los síntomas normal, pero yo no, al menos en mi propia experiencia, yo no tuve ningún problema. No dolor, no nada, no consecuencia. Estoy muy feliz de haber tenido esa oportunidad y les pido a todos que tengan mucha paciencia, pero que todo se va a lograr si podemos tener calma y podernos dar la confianza a las personas que nos están otorgando la oportunidad de recibir la vacuna. Gracias, señor gobernador, por preocuparse por este pueblo.
Thank you.
Le queremos y le respetamos.
Gracias. Thank you, Linda. Rebecca Vasquez got the vaccine 2 weekends ago. And Rebecca, tell us about your experience.
Sure. My experience was fast. We just went to the site. Once we got the appointment, we were there on time. We filled out a little questionnaire about, something little, just wanting to make sure that you're healthy to take the vaccine. The the information I was asked was my zip code and my birthday. I got the shot inside the car. They moved us to the side for 15 minutes where paramedics were there making sure that the reaction was well. And after that, I just got to go home. Very fast, very nice. I didn't have any reaction to the vaccine. I took it like at 1:30. By 8 o'clock, I had a little sore arm and maybe felt a little bit, my body was a little bit kind of like when you have a flu. I slept through that. In the morning, I woke up in normal. Thank you, Governor Polis, for guiding us through this process.
Rebecca, ¿quieres decir algo corto en español también?
Sí, les pido a mis paisanos que no la piensen, tomen la vacuna. Nomás un poquito de adolorido el brazo y un poquito de dolorido el cuerpo y san se acabó. Es todo lo que sucede y se van a proteger de esta pandemia que pues puede llevarse su vida si no se protege.
Thank you so
Gracias.
much, Rebecca. Gracias. This is how a pandemic ends. It's one person at a time, one vaccine at a time. We are rapidly getting there. 71% towards our goal of vaccinating 70% of people 70 and up. We continue to deploy the vaccines that we receive in our state, but we know that until more Coloradans have been vaccinated, it is still a threat. There are elevated levels of the virus in our state and around the country. More important now than ever before. We know the end is in sight. Double down. Wear a mask. Stay at least 6 feet from others where you can. Limit social interactions to people in your own household. Let's keep these trends. Let's avoid a third wave in Colorado. And let's put this pandemic in the rearview mirror as soon as possible. I want to remind Coloradans age 65 and up, you can sign up for an appointment or learn where you can sign up for an appointment at www.covidvaccine.org. Then you can sign up at a provider near you or providers near you. If you're having trouble navigating the internet, call 877-268-2926. Stay safe, stay healthy. I'm happy to take some questions. Thank you.
You said that Coloradans can get vaccinated in any county, but we're still hearing about resistance to that from some smaller counties. Have you warned or sanctioned any local public health agencies or providers for not complying with this mandate? And also, secondarily to that, does this mean that people can travel from New Mexico and other states into Colorado to get vaccines?
Yeah.
Have we had problems with that, and have people been turned away from that?
So look, we've administered 559,938 doses, and that's being done by so many partners across the state. We do ask that they keep to our prioritization and the rules, and by and large they have. Now, it's not as much of a story, I get it, when it is given to the right person at the right time who meets the eligibility criteria. But with that many vaccines, you'll find some cases where somebody incorrectly turned somebody down because they were in the wrong county or incorrectly gave it to somebody who might not have met the criteria. But that is the exception, not the rule. We absolutely have issued warnings to partners that has been reported to us have had issues with that. There have not been any sanctions yet because there have not been repeated systemic violations that we're aware of. But whenever we hear about it, we remind the partner or the county of the statewide guidelines that if you meet the eligibility criteria, and in fact, while an identification can be requested, it can't be required that you have to have like a state ID. But if you meet the criteria, you should get the vaccine. And we've heard of a few exceptions where that hasn't happened. We pass along warnings to those involved, but there has been no evidence that we've seen of a systemic violation of those protocols that would warrant any penalization.
Folks get vaccinated in Colorado.
Yeah, there's folks that live on our border that both ways. There's folks in northern Colorado that have probably gone up to Cheyenne. There's folks in Cheyenne that have probably come back to northern Colorado, in the Southwest, in New Mexico, both ways. Because we don't require a particular state ID, we want to make sure people are in that eligibility category. But again, this has not been widespread. This has not been systemic. Has it occurred? Yes, there have been Coloradans who've gotten it elsewhere in roughly equal numbers from people from other states that have gotten it here. But it creates significant, unintended consequences if we were to go towards a verification model with regard to that, when it roughly balances out for Colorado, and it is not yet a systemic problem. But we certainly want to keep our eyes on it to make sure it doesn't become a systemic issue.
From 9 News here. Thanks for the time. So this weekend, Jeffco Public Schools sent out a message to 14,000 employees about extra doses left over at an SEL health event. And it kind of ended up creating some chaos. Is this how the process is supposed to work? And how do you ensure more efficiency in the future?
Well, first of all, I really applaud the quick thinking at SCL Health and Jeffco Public Schools for making sure that those 200 doses were not wasted. Why were there 200 extra doses? There were more no-shows for appointments among folks 70 and up than they had expected. There were 200 extra doses. And I support, the state supports all extraordinary efforts to make sure that no doses are wasted. A far worse scandal would have been had those 200 doses been disposed of. Instead, thanks to quick thinking and creativity, they were able to get 200 educators there to make sure that the doses were put into arms of those who were scheduled to be vaccinated in the coming days anyway. Now, clearly, in retrospect, there's better ways to figure that out. And I think that they've implemented steps where people that are willing to respond within a brief period of time will get the alert notice if they're available. We want to make sure no doses are wasted and, of course, minimize disruptions in pursuit of that first goal. The SCL and Jeffco partnership achieved the first and primary goal of wasting no doses, and I think that they have learned from the experience and will do their best to minimize disruptions the next time the situation presents itself by making sure that they notify people that are close by and able to come in quickly rather than an entire list.
Hi, Governor. This is Ashley Michaels with Fox 31. The goal, obviously, 70% of people 70 and older to be vaccinated. You just said we're 3/4 of the way there. Why already start to move on to other groups like 65 and up when we haven't met the goal yet of those 70-year-olds who call us all the time saying, I can't get a vaccine?
Yeah, so the goal is for everybody, for 70% of those 70 and up to be vaccinated by the end of February. If we limited vaccines only to those 70 and up, we would not be able to deploy vaccines fast enough, and vaccines would sit on shelves in Colorado. As you get towards the latter half of any group, you need to open up the next group so that you don't create a bottleneck of demand. So 65 to 69, there's some that are starting to get mixed in this week in different parts of our state that have made more progress with 70 and up. There'll be more 65 to 69 mixed in the week after that, the week after that. But without those doses would likely sit on shelves. And so it's very important that we rapid turnaround, every dose used within 3 days, that we have a sufficient demand. And while there are still some people 70 and up that are waiting, and they will get it in February, we wanted to make sure that we didn't create a bottleneck that kept the vaccine on shelves when there's plenty of willing folks 65 to 69 ready to receive it. Follow-up question?
No, thank you.
Okay.
Vinny Delchudice at Bloomberg News in Denver. Regarding the White House conference calls with state governors on COVID-19, is there ever any pushback, not just polite differences of opinion, but pushback by governors who disagree with the new administration's strategy, masks, supplies, et cetera? Thank you very much.
On this call, Vinny, there was not Governor Hutchison and other Governor Baker and others complimented the efforts of the Biden task force and administration, specifically increasing dosage available to the states by 9,000 starting next week, but continuing that for several weeks. I think there's increasing frustration about the lack of visibility into the quantity of Johnson & Johnson supply, notwithstanding that there is a separate FDA approval process that has scientific integrity that the politics should not influence. But what we should know is when and if it's approved, what those quantities look like first week, second week, third week. So I joined and share that desire to have more knowledge about so that we can plan so that we do have a week or two notice on what we're going to get with regard to the single dose, highly effective vaccine that is on the horizon. There was also some discussion of the federal program around direct to pharmacies and now direct to community health clinics. And I share the concern of governors that we want to make sure that states are in a position to hold those pharmacies and community health clinics accountable toward using their doses, because this has been a problem not just in Colorado but in other parts of the country where many providers, do a fantastic job, get it out right away, we reward them, they're part of the program. Others have had to have dwindling supply, or we've had to cut off their supply if they haven't successfully get into doses, or they take 10 days or they take 8 days. We simply say, get your act together, or we'll work with other providers. There's plenty of folks who can do vaccinations in Colorado. And so we wanted to make sure, and again, I share this concern, that any direct federal program that goes to pharmacies or community health clinics is also subject to accountability to me as governor of Colorado, to other governors, to make sure it doesn't sit there for a week or two and actually gets used right away.
Hi, Governor Seth Klayman with Gazette. 2 questions for you. First, how confident are you that educators will meet the timeline you've laid out? And DPS, they've said they're expecting about 1,000 doses a week, and that doesn't seem possible to hit all their employees who would be eligible by the end of the month. Second, have you considered or come up with an answer at all to Denver's request to give increased priority to people experiencing homelessness and living in shelters? Thanks.
So first of all, we do a lot of math. Luckily it's simple math. It's like 8th grade math. It's addition, subtraction, multiplication, and division. We check, we double check. There are about 120,000 people that are eligible as educators, child care providers, school workers. We model that the number that is likely to receive that based on polling and based on real life examples is generously 90,000 to 100,000. And we hope it's closer to 100,000, but it's more likely closer to 90,000, which is about 75%, will receive the vaccine. So that's 90 to 100,000 doses. We then make sure that out of our state supply, there's that number of doses for educators over 3 weeks. Over 3 weeks. So over 3 weeks, that 90 to 100,000 will be utilized for educators, meeting the desires of every educator who wants it to get vaccinated. So again, simple math, checked and double checked. They're not competing with the 65 and up and 70 and up. They don't go online and schedule. They're not part of some randomized database. They get an email or contacted by their employer, the school district or school, that says go in at this time, at this date, or here's how you set up an appointment with our provider that our school district works with. So it's not the same randomized process that folks can pick where they want to get it and get it. You have to get it at a certain place if you're an educator that is designated by your employer. And yes, the quantity and the math is such that the 90 to 100,000 that want to receive it will have those vaccines and be able to do that in the next 3 weeks.
Sorry, and my other question was if you considered or come up with an answer to Denver's request about giving more priority to help.
Well, it would cost lives to divert vaccine from people that are in their 70s to younger, healthier people just because they happen to be homeless. We give the same prioritization for homeless Coloradans as we do for any Coloradan who has a home. That is, everybody who's 70 and up who's homeless already is eligible, should have been vaccinated. If they're 65 and up, they are now eligible for vaccination as well, regardless of whether you have a home or don't have a home. And I would add that logistically, it will be a lot easier for the needs of the homeless population to use the single-dose Johnson & Johnson vaccine, which is much more effective with 1 dose than Pfizer or Moderna, which are only somewhat effective with 1 dose. And being able to track and make sure that people come back 3 to 4 weeks later is a problem across the entire population, but is an even greater problem among those who lack a regular address. So at this point, we're continuing with our state prioritization of 65 and up. And we look forward to protecting our most vulnerable as quickly as possible and hopefully not delaying that by doing other groups that are less at risk due to the virus.
Ashby from the Grand Junction Daily Sentinel. So I'm starting to hear complaints from our local public health people out here in the hinterlands, not just about the number of doses they're not getting, but in the process that they're having to order. They say that they have to order them on Thursdays, and then they don't find out until late Friday how many they're going to get the next week. And they say that that makes it problematic for trying to schedule people for the following week, and they have to wait till the following Monday, saying that they're now a week behind. They're also complaining that they are not being told how many doses are going to pharmacies and hospitals and local providers, and they have no idea how many doses are actually coming into the county, so they don't know how to prioritize because they just don't have the full information. So I don't know if you're hearing this other parts of the state. Is this something that's concerning to you? What?
Is your local public health authority or your commissioners or who?
The local public health director.
Yeah, we are happy to share with every commissioner and local public health director, as we have in many areas, exact number of vaccines by provider in the county, dates provided. Now that we have more reliability on the federal side on supply, we are also translating that into more advance notice on supply quantities for our providers in Colorado. We are now doing twice weekly deliveries, Monday, Tuesday, and Thursday, Friday. So there's twice weekly deliveries. We expect that every vaccine delivered on Monday, Tuesday is used by Thursday, Friday. Every vaccine Thursday, Friday is used over the weekend before the Monday. We hold all of our providers accountable for that. And we welcome the help of our local public health authorities in making sure that all the vaccines are used in the county. So any LPHA or county or elected official, and we've had this conversation with many mayors too, we're happy to share with them exactly the quantities of vaccines that are sent to their communities, the amount utilized, and we ask for their help in getting on those providers to make sure we get the remaining doses out. The only asterisk on that is this direct federal program, which started out as the nursing home and long-term care facility program. They're now on their second doses, but that is not under our purview, so we don't always have the exact counts on those county by county. I mean, we know where the sites are and we have some information, but not the same information as if it came through us. And now the direct federal program with pharmacies and community health clinics. So again, we have some visibility into that, and that's one of the areas where we want more accountability and visibility. But that's all of that combined just represents, maybe 10 or 15% of the total number of vaccines. Most of it comes through us. We will give our partners more time now that we have more time. It is twice a week rather than once a week, and we're always happy to roll up our sleeves with any local public health authority, county commissioners, or mayors to share with them what's going on in their community. And we'll do that for Mesa. We'll invite all the mayors, city council people, commissioners, LPHAs, and we will give a Mesa County update to them in the next day or two.
Hello, Governor. Jesús Carrasquel from Noticias Univisión, Colorado. Gobernador, ya inició la vacunación para los maestros, pero algunos no quieren ser obligados a colocársela. ¿Será requisito para que puedan volver a dar clases en persona? Y si existe suficiente cantidad de vacunas para atenderlos en el estado.
Ser vacunada no es un requisito para volver a las clases. Ya regresamos a las clases en casi todas las partes de nuestro estado. Y es seguro porque todos los estudiantes y maestros usan tapabocas y también otras vías para proteger a las maestras y estudiantes. Obviamente lo recomendamos para los maestros, pero al final del día es una decisión personal y yo lo respeto. En cuanto a la disponibilidad, cada vez que hemos tomado la decisión de hacer las vacunas disponibles a más personas, lo hemos estudiando y analizando profundamente para asegurarnos que tengamos la cantidad disponible para poder vacunar a esta etapa. Me siento muy seguro de que hay suficiente para los maestros durante el mes de febrero.
Quisiera preguntar a Mrs. Linda y Mrs. Rebeca,
sí.
¿Cuál es su mensaje a la comunidad hispana en cuanto a la vacunación?
Okay.
Yo digo que no la piensen, que no hay ningún problema con tomar la vacuna. Los requisitos para tomar la vacuna no son más que les piden su código de donde viven y les piden de su cumpleaños y es tan facilito así. En el carro es donde les van a administrar la vacuna y en 15 minutos ya están listos para hacer lo que sigue en su vida. No hay reacción que de veras que sea peligrosa. Y para el siguiente día todo va normal, todo sigue adelante.
Linda?
Bueno, mi mensaje para toda la comunidad es, primero, que se cuiden mucho, porque esa es una pandemia y siento mucho por todas las familias que han sufrido pérdidas pues, de familiares, que no es peligroso, que es un proceso que no necesitan eh, un seguro social o una cosa, se vacunan a todos y sobre todo no cuesta más que poner el brazo, un piquete pequeño y pueden salvar vidas. De otra forma, serán como, digamos, andar en la calle y poder contaminar a las demás familias que pueden sufrir. Desgraciadamente, en nuestra comunidad somos los más afectados porque no tenemos acceso a al internet o no tienen los medios de donde comunicarse o el idioma mismo. Por eso recurran a nosotros para poderles ayudar. Es un proceso facilísimo: nombre, fecha de nacimiento y el lugar, y llegar a tiempo. Eso es todo, y la voluntad de ustedes para salvarnos todos de esta epidemia y volver a hacer una vida normal.
Thank you so much. Next question.
Governor Charles Ashby from the Sentinel, I noticed you didn't ask me if I wanted to ask a follow-up question, but you've complained about the federal side of things for some time. I'm wondering if, you know, the ball rolls fast downhill. I mean, obviously people are down here complaining about the state. You've been complaining about the feds. How has that improved? Is that gotten better in your sense? Where do you see more improvement needing to happen so that you can have fewer county people yelling at you so you don't have to yell at them?
Yeah, so, you know, we can focus on the glass is half full or the glass is half empty. What's gotten better? Increased supply, now with the announcement of 9,000 more a week, 3-week visibility into supply, twice weekly deliveries. We are then able to translate that into information earlier for counties, more updates in real time as soon as we know it. All of our partners know it. What still hasn't happened, there's still big question marks around when and if Johnson & Johnson supply comes online. We obviously would appreciate even greater quantities than we now have. We need more visibility and transparency into the nursing home program, the direct pharmacy program, and now the community health program, so that we and local elected officials can also hold those providers accountable for administering every dose they get within a few days of when they get it. So I think things are getting better. We share whatever we learn in real time with all of our partners. We'll look forward to having a call with the electeds and Public Health Authority in Mesa County to go through those numbers with them, and then continue that with updates as soon as we get information.
Thank you, sir.
Governor, there's a push at the State House on topic of coronavirus to enact a potency limit on marijuana products. I'm wondering if you've heard about this and if you've taken a position on it. If you think this is a good idea, obviously the industry is pushing back pretty intensely.
So I want to go back actually on the question you asked earlier too. We have issued warnings. There have not yet had to be sanctions because we have not found any violations that are ongoing and systemic. Have there been violations? Yes. When we notify providers, they then indicate that they will get the word out to their folks. We have found no systemic and ongoing violations of the prioritization or the geographic where people live in our state. But if we become aware of systemic ongoing violations, then we would take stronger actions. But at this point, they seem to be uncoordinated individual who simply make a mistake. And our partner organizations are willing to work to correct those mistakes. With regard to marijuana potency, we haven't seen a bill yet. We share the goal of protecting children. I think the best way to do that would be to increase penalties on anybody who sells legal or illegal marijuana to children that are underage. If we share that concern completely, we believe that marijuana at any potency level is inappropriate for people under the age of 18 unless it's specifically prescribed medically under tight medical supervision. But generally, it's not acceptable recreationally for those under 18, and we would support stronger penalties for anybody involved with procuring or offering marijuana products to people under the age of 18. Phone? Anybody else in the room with a follow-up? Okay, look, let's stay safe, Colorado. Thank you again to our two guests today. I appreciate them joining us today and so many other Coloradans that are getting the vaccine every day. If you are age 65 and up, sign up online. Like Linda and Rebecca, you'll find that it's simple, it's easy, it's almost entirely painless, and it will allow you to get your lives back as an individual faster, and frankly, it will allow all of us as a state to return to normalcy that much sooner. Thank you all for joining us.